Hi everybody, this is one of my great patients, Steve. He's coming in today for to tell you about what happened. And he had really serious, debilitating illness when he first came in here. To me, it looked like it was some type of viral infection in the nervous system, and it had been progressing, I think, for about 5 years. You said?
I was sick for 5 years.
About 5 years.
Yeah.
So what were you experiencing when you first came to see me? I know there was one thing, it was no hope.
Yeah,
and I think
definitely.
this is the worst part of the illness with people, because they just battle and battle and battle, and they get shifted around from doctor to doctor to doctor, knowing, they want to trust. All of us, we want to trust our doctor because we think they have the education to help us, but what ends up happening is we have so many weird, situations and things going on, and we don't get any help. We start to lose hope. When the mind starts to lose hope, it affects all the body, the neurotransmitters, the hormones. It's amazing how the mind is very strong. And you came in kind of with that no hope, just trying to grasp, will that really work, Dr. Churchill? Are you sure it's going to work? So I'm like, well, let's just try and see, and then kind of you can talk about what happened after that.
Yeah, well, I came in, I had been sick for about 5 years. I'd seen several doctors, and always with the promise that these doctors could help me. I did Western doctors, then even Eastern doctors. But when it came to you, nothing had been working. I was number one, I was extremely fatigued. I could barely get out of bed. No one could figure out why. And I had a lot of pain and inflammation in my ears and my sinuses and in my head, just my head. My body felt like it was fighting something and losing. And I just felt like I wasn't going to be able to function anymore. And I came to see you, and first thing you did is wanted to run the necessary tests, things that my Western doctors hadn't done before. And you discovered a lot of things that were going on that other tests didn't show. And so you put me on a plan, and I remember very clearly, you said, we're going to put you on these things based on your test results. And I think in 2 weeks you're going to start feeling better, and in 3 months you're going to be significantly better. And I'd heard a lot of things before from doctors, promises, but it's exactly after 5 years of going through a lot of pain and losing hope, it's exactly as you said. Within 2 weeks I noticed a dramatic increase in energy, and my pain levels started going down, and now it's been a few months, and I'm significantly better. I'm better than I've been in 5 years.
That's great, really great. What was the diagnosis from, if you did get a diagnosis before, from the other doctors? What did they say, what was going on with you?
No one really knew. I'd seen it on the Western end, infectious disease doctors, endocrinologists. They saw that I had inflammation, but they couldn't. I complained of nerve pain, and they couldn't see it. They couldn't, I had problems with my thyroid, and the answer was always just to put me on thyroid medicine, put me on blood pressure medicine. I'd never been sick before until I got this problem 5 years ago.
How did you get it? Do you know how you got it?
It was a bizarre story. I went to sleep one night feeling great. This is about 5 years ago, and I woke up and I felt like I had literally been bitten by something or poisoned, or my body was just extremely swollen. My nose was gushing, my heart was racing. I woke up like that.
Wow.
So something happened, and it was very difficult to go to doctor after doctor and them say, we don't see anything. They ran all the tests.
What were your symptoms then? What was happening with you?
I had extreme pressure in my nose and my ears. My ears had swollen up inside, but they couldn't see anything. But it had that incredible pressure, and I got violently dizzy. High blood pressure immediately started. My thyroid started not working. I had pain in my abdomen, and their answer was, we don't see anything in the tests, and we'll put you on blood pressure medicine. I said, that's something else is going on.
Right. I forgot, had you traveled outside the United States?
I have not traveled.
Nowhere?
No.
Did you eat any sushi restaurants?
No.
Any weird restaurants?
Vegetarian. I didn't eat anything. So it was a complete mystery, and it was, I think, one of the difficult things was not having a name for it, not knowing what it was.
Well, I mean, when you came to me, I thought, this might be some kind of weird viral infection, and but I said, even if it was, now I got to find out what damage it's been done. and I just assumed there was something in the nervous system and the sinuses, but then you have the heart. I mean, it's systemic, the whole body.
Yeah.
So we just said, okay, let's run organic acid test. Let's do a stool panel. Let's do a food sensitivity panel. Let's revive the adrenals because he was really having a hard time. Let's see if we can get the ATP to go up and clean up the diet. And well, we did about probably 15 different supplements at least, and big on probiotics. Really, 2 different types of probiotics to rebuild the immune system. So rebuild the adrenals and rebuild the immune system, get it stronger, get it a fighting force, and then if there is something in there that needs to kill off, it'll take over and do it.
Yeah.
So at least so far, that's I think what's happening. So I'm really glad that you're feeling better. So that's great.
Significant progress in the short amount of time I've seen you, and the greatest thing is I'm feeling better, and I do have hope.
He has hope now.
I have hope.
That's number one thing.
Yeah.
And you're teaching